Hello and welcome to all of our Gold viewers who are here with us today. I'm Kristen Schwartz, licensed midwife and MC here at Gold. And I'm today here with Anna Maria Rossetti. Welcome, Maria. Anna Maria, it's so good to have you here.
Thank you, Kristen. Good to be here.
You are, of course, part of our Labor and Delivery Symposium that we get started with in October. We're very excited about this. And you have a wonderful presentation for us this year titled Fetal Rotation, Fascia in the Nervous System, Rethinking Labor Dystocia. So I want to jump into that in just a moment. But first, I want to learn a little bit about you. You are a midwife, is that correct? And tell us a little bit where you are and a little bit about your work.
Yes, thank you, Kristen. I am a midwife. I've been a midwife for 21 years now. I'm in Italy. I'm an Italian midwife. I'm also a spinning babies approved trainer. And I think that this got me into the nerdy part of studying what are the mechanisms involved with fetal internal rotation. I've been a hospital midwife in Italy and UK, and also in missions in war zones in Afghanistan. And I've been also an independent midwife for the second part of my midwifery life. And so I really wanted to investigate what are all the factors and variables related with the fetal internal rotation, considering the fact that there are so many different settings and scenarios that midwives face all over the world, from the most medicalized setting to the most rural area. So that's why I'm here.
Fantastic. Yes, and your background is really amazing. You've been working in hospitals, you've been working in rural areas, war zones. So you've seen it all. You've been there in out in the field. And on the same token, you love research. You like really digging into things, looking at them really, under a microscope, seeing what's going really on. What does the research say? What is supported and such. And so labor dystocia is, we all deal with that as midwives, right? It's something we have to deal with and we have to be ready for. And but you have a little bit of a different approach, which I find really exciting. You talk about fetal rotation and fascia. So I think that is an area where many of us want to learn more. So tell us a little bit about that, the fascia aspect and your lens of the topic.
I think that what fascinated me about fascia was the fact that its connection with the whole body and mind is made through the vagus nerve and the autonomous nervous system. And that was for me a link into understanding how environment, how the perception of birth, how our views around birth when we are attending birth can modify the reaction of the fascia of the person. And this is, and also because when we are talking about the autonomous nervous system and the fascia, um, we tend to simplify it, like it is if the person who is in labor is relaxed enough and supported enough, the fascia will flow as it should. But for real, this is not just the case, because there are so many factors involved in this capability of the fascia to let the baby glide into the mother's body during birth, and even the baby's fascia and the baby's nervous system interact with this scenario. So, for example, the baby needs to be activated by the social engagement nervous system so that the hair fascia will glide to, producing those movements that are the same movements that the baby will produce outside of the uterus to connect with the parents, to connect to the breast, to breastfeed, and etc. So we see that fetal internal rotation, it's a gliding in love and joy that happens at a very, very subconscious level. And we are formed as humans with this pattern that is the ventrovagal system, as Stephen Porges explains to us. And that's what was fascinating me, aside from and together with biomechanics. But yes, in my presentation, there is a little biomechanics because I wanted to offer this overview through a lens that gets mm, from the periphery of the topic, like an onion, and then going inward.
So peeling the layers, so to speak.
Yes.
Yes, and absolutely. And I love what you just said about the gliding and the joy that you mentioned, because many of us see, labor as almost like an isolated event, right? Like we go through labor and then there is the baby. You have the birth and then there's the baby. But what you mentioned with the movement and the connection, that obviously doesn't, end, with birth, right? That then we always think it starts then, but it already starts in utero well before, and with that beautiful dance, almost like how you describe it, right? I love that lens, actually. I really like that because, it opens up so many new possibilities, right, Anna?
Yes, and I also think that we need to see the baby in its journey through the pelvis as a subject of interactions and not just an object to receiving pressures and directions by biomechanics. Because it is not so. Sometimes we are focusing on the lack of internal rotation during a labor when a baby is clearly in a freezing state, is freezed and is shut down because the environment around him is frightening, or because there is a lack of nutrition, very, very basically. So we are wondering, why is the baby not moving in the pelvis, and the baby is just prioritizing survival other than meeting the mother. And but yes, the fact that we cannot um, separate the movements that babies do in the pelvis from the movements they do outside of the womb when they are looking for their mama or the breast or the father or the other peers in his family, the other allo parents. And because the baby is essentially, when we are in the perinatal stage, we are living creatures. So our ancient brain is working. We are a bubble of emotions and of relationship, and we cannot perceive ourselves as alone. We are always together with. So
Right. Oh, that's beautiful.
completing a fetal internal rotation for the baby in the pelvis is manifesting the perception of its togetherness with the mother.
Yeah. Ah, that's so beautiful how you said that. And, I want to go back to what you said just a little bit ago when you said, like, when we have labor dystocia, there is maybe something going on with the baby. It's, doing some kind of self preservation there, or reserving energy. And many of us, when we think, oh, labor dystocia, now we jump into action, biomechanics, right? So now we need to change position and get labor going again, or what's going on. So often we jump into this very proactive approach that we want to, with positioning and walking and you name it. And often we don't really look at what's going on with baby, right?
Yes, and the baby, and we have to think that the baby, of course, is a person on his own, but is also the representation, the most clear representation of the woman, the laboring person's inner state. We can we can say cognitively, oh, yes, I feel safe here. This is a good place to give birth. I trust these professionals because they know their job. But we have a very ancient brain smelling the environment around us. And even if we can be very cognitive into the realization, this is a good place for me, blah, blah, babies and fascia inside of our bodies will tell the truth. Is it
Huh.
really, really, really safe for me? Is it really, or I'm trying to convince my fascia, my subconscious, that's my baby, that this is safe enough. And so it's a mirror. Is a mirror of how very deep inside that mother, the person in labor is feeling. around in that environment and with the person she has around. And so yes, in my presentation, I wanted to speak a lot about how we adjust ourselves, because when we are attending birth, we are the environment for that fetal internal rotation, and we are as environment, we are neuromodulators. And sometimes because we are in the fix-it mode with the bias, which is very good for us things, absolutely. But I'm a spinning babies approved trainer. I really believe,
Right, of course.
yeah, a wise use of biomechanics. Nevertheless, what we need first is to adjust ourselves. Adjust. Why am I rushing to adjust this? These
Yeah.
persons I'm taking care of, are they in the condition of doing the movements that are not just biomechanics, but
Mhm.
I'm there is an internal movement that comes from the mother's fascia, driven by the autonomous nervous system, and the internal movement of the baby, driven by its fascia and the autonomous nervous system. And that's the spontaneous fetal rotation.
Mm.
So we can use biomechanics to help them do that. But it doesn't always work if
Mhm.
because I believe that when it's not working, it's because we miss the point that we should work with physiology more and readjust the conditions, the internal conditions, so that the fascia and the autonomous nervous system can move by itself. So this is the point of my view on fetal internal.
Beautiful. So much wisdom in what you just said. Number one, we are the environment, and when we are going into fixed mode, yes, you're absolutely right. Why are we doing this? Obviously, then there's obvious reasons. If the baby's heart tones or not good or something is going on, of course, right? But maybe what is happening also is maybe we had a previous birth that was, a difficult birth, as a provider, and we are internalizing. We are like, oh, we don't want to repeat this. We're looking out for warning signs that maybe are not there, right? Like we all have been there and rushing through things because we are hoping we are proactive and avoiding any possible things that could go on. When we are the environment and really need to take a step back and really think, of being here in the moment and breathing and making sure we are the best we can be for that particular family. And then also what you mentioned, yes, biomechanics have, of course, the role. It's important, but then if it doesn't work, what's going on? And that was absolutely beautiful what you just mentioned there. That was so much wisdom right there. So, Anna, before I let you go, any final wise words for our viewers of what you hope they will take away from this presentation?
I would like, I've offered two exercises during my webinar. One is how to connect to this vagus nerve with the uterus and pelvic floor through two different ways of using our breath. And diaphragms, plural, because we had different diaphragms from top to bottom in our body. And this is something that I was taught by Elisa Benassi in Italy. And it works very well, especially with difficult labors, especially when we have inductions of labor, um, drugs ongoing during a labor, because it's so powerful when we can use our inner resources, like our breath. And then at the end, I offer the obturator internal treatment for the pelvis. That it's again a way to speak the language of the levet. That my idea was to offer everything
Um, sorry, Anna.
And
I
oh, I went away.
Yes, I think you went away for a moment there. Maybe we can cut that out at the end.
Yes.
Yeah, so sorry. I thought maybe it was me.
No worries. So the question was, I can repeat it.
What are you hoping our viewers are taking away from this presentation?
Oh yes. Um, I'd like they could take away uh, a new operative way to treat labor dystocia, because for sure I've brought in this webinar couple of examples of biomechanical interventions, like the use of the diaphragms or the treatment of the internal obturator in the pelvis. But the fact is that we know so many interventions that are hands-on or biomechanics. What I really want colleagues to bring home is to take their own knowledge and connect the dots with what I bring in this webinar, so that every now and then, that when they will be facing a labor dystocia, they will think, okay, I know how to do this and this other technique, but first let's peel the onion. Let's go there. Let's step by step. Let's dive into it. And maybe they will discover that some of the biomechanical treatments that they do and provide, they are not always in need to be put into action, because the body resolves itself.
The body resolved itself. Thank you so much. That was a wonderful, way of saying it. Thank you so much. I'm looking so much forward to your presentation, and thank you so much for being here at Gold with us.
Thank you so much for having me again.
Mhm. And now some information for our viewers. If you would like to find out more about this presentation and the other wonderful presentations of the Gold Labor and Delivery Symposium 2025, we invite you to go to goldlearning.com. We also have a free keynote presentation that will be live on October 6th. Thank you everyone for watching, and have a lovely rest of your day, everyone. Bye-bye.